Okay, so this is all about the BBMRI-ERIC. And if you never heard about BBMRI, it stands for Biobanking and Biomolecular Resources Research Infrastructure. And it's 2B. One is for biobanking and the other is for biomolecular resources. So 2B, remember that. The other one is the ERIC. If you never heard about that one too, it stands for European Research Infrastructure Consortium. And that was something the Minister of Finance did 2009 in Europe to create a new legal entity for infrastructure. So 3 countries can come together, decide to do a legal entity like the ERIC and do an infrastructure for some kind of research. So we have 7 pillars of BBMRI-ERIC. It's, of course, scientific excellence. We are going to have one type of infrastructure for Europe when it comes to biobanking, access to high-quality human biological samples and associated data, access to high-quality biomolecular resources, ethical and legal compliance, long-term sustainability, and international integration. So 3rd of December last year, we got our legal entity, BBMRI-ERIC. And we have 16 countries who are on our back, and one international organization, ERIC, you know, the cancer organization that is WHO-driven from ERIC. So we are actually the biggest ERIC ever launched in Europe when it comes to health-oriented issues. And we have about 6 to 8 countries around the corner that will join within 1 or 2 years. So we might be the biggest ERIC ever launched in Europe when it comes to this kind of legal entity. So that means that on the other hand, we sort of have a study population of 400 million individuals, if you so like. The governance structure of BBMRI-ERIC is that we have the assembly of members, the countries. So remember, this is an infrastructure, it's not a project, and it's driven by countries, the members. And between me, who is the Director General, I have a steering committee and a finance committee. So this is the upper part of the governance. Then, of course, we have all the national nodes, and every national node has a national node director. And one thing I will come back to soon that is extremely important is that we also create common services. And we have now created a common services, or will create a common services for ELSI, but soon more on that one. So every year I suggest a work program for the Assembly of Members. The work program for 2015 I will suggest for the Assembly of Members next week in Graz. This is a work program 2014 that consisted of 8 work plans. First of all, it was to start up the whole thing, because building up an ERIC is actually to do a startup company, because nothing is there. 9 months ago, we even didn't have a bank account, so it's a really startup company. So if you are going to plan to do an ERIC, think twice. But anyhow, one of the things is that we, of course, do an e-infrastructure for biobanks. We did something also for the preparatory phase. We have started up a lot of relationship with other bodies. Quality and expert centers are 2 things I don't have time to talk about, but coming back to common services soon again. Every work plan is defined with 7 parts. It's the background, the mission, goals and deliverables, priority, time plan, project group, and resources. If you're interested in the work program for 2014 is on our web. So one thing we decided for 2014 was to launch the common services for ELSI and start the common services for IT together with other big infrastructure in Europe, like the Elixir, that we soon will release a memorandum of understanding together with what we are doing, what they are doing, etc. When it comes to the common services, it forms a conceptualization to provide the biobanking community and biobank user with expertise, service, and tools specific to the practice of biobanking. And we have statutes that define exactly what we should do and don't do in BBMRI-ERIC, and I'm not going to read it, but it's on the web page also what actually common services is. So we went out with a tender for the member countries, and to ask but when we have a tender, I mean, all members countries can ask for leading this, because that's a base for the common services. There should be 1 country in lead, and then they have to ask it to the tender. And this is sort of the short story of the tender. Provide solid monitoring of ELSI issues related to biobanks, follow up relevant evolution in legislation regulation at the European level, intervention to address joint matter for the biobanking community on the European level, build conclusion and advice on a sound scientific academic basis and experience in ethical review of European international projects, provide updated background information and practical guidance to biobanking and respond to ELSI issues, ensure the dissemination of results of relevant survey and study toward the various audiences, organize tools and services to address ELSI issues, organize experience sharing exchange regarding ELSI aspect between BBMRI-ERIC members, set up training and education on ELSI issues related to biobanking, provide an ethics check of compliance for research proposals submitted by BBMRI-ERIC in compliance with the BBMRI business plan and statutes and with the European Commission Research Ethical Framework. So this is short, the tender. It's also on the web if you like to read. So the whole thing was that then this tender went out, and we also asked this time to have one application from all the member states, because we didn't want people to compete about the ELSI issues. And we got one tender. Here is the timeline. So it was sort of moving in the fast lane. We had first a preparatory meeting for some months with the people who was aboard already during the preparatory phase. The call was published in late April, closed late July. The reviewer proposed 18th of August. The reviewer confirmed 17th September. We received the review 10th of October. And a couple of days ago, we had the review commented on the 28th of October. And next week, we will meet the assembly of members, and they will go to say yes or no to these common services. And if that is a yes, we will kick it off in the beginning of next year. So it was one, as I said, Joint Consortia suggesting for Europe, and it's going to be a board of 4 people led by Anne Thompson from France, Maria Luisa Lavintrano from Italy, Mats Hansson from Sweden, and Jasper Boomberg from Netherlands. And they should build of existing things that has been developed during the years in Europe. This is sort of an organogram of the BBMRI-ERIC ELSI Common Services, and I'm not going into details in it, but as you know, every national nodes or every country has some kind of ELSI groups working, and they could have a vote in these ELSI Common Services. Observer can't have that, but they will be involved anyhow in this board, executive board of national ELSI people. I also mentioned the board of directors that will also have the coordinator, and that coordinator will be hooked up with me. We also are setting up a stakeholder forum quite soon in Europe. But the most interesting thing with this BBMRI-ELSI Common Services was when we planned it, it was before BBMRI-ERIC only. But now I'm involved in 28 Horizon 2020 calls, and most of those calls, people ask me to involve these common services for ELSI. So it's sort of have the flavor of, even if it's not launched yet, ELSI services for Europe when it comes to all the life science project. So that's all for me. Thank you.